Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. We are in chapter 34, coordinating care for patients with hematological disorders. It's all about anemias. We know that there are 11 plus anemias, and they are from the red blood cells, white blood cells, bleeding disorders, and the lymph nodes disorders. And how NCLEX, this exam will play out in this chapter. So let's assume that NCLEX is all about this chapter, let's say. But this chapter is very important. Why? Because it's a lot of anemia. Worldwide, it's very high population having anemia. And think about children and pregnant females, they have anemia and folic acid. Think when a doctor gives to a pregnant who gets supplements that they contain those type of supplements like iron, B12, folic acid is very important. So what I remember during the LVN exam, I had to learn, and I remember there were a lot of questions about this, and it was like what specific food it's good for pregnant, because that was neonatal, so it's like pregnancy and newborn. And how you teach a patient kind of thing, and either it's a food related, and think about what is in high in folic acid, vitamin B12, and vitamin C. Usually we say it's orange juice, and take the iron with orange juice. Then what else? Beef. Beef has beef liver has a lot of folic acid, and I find out that there are also tablets, and actually I think they are from Australia or something. They are very fancy, very high on this. And what else? Vitamin C, tomatoes. I could not believe tomatoes the highest in vitamin C. I could not believe. I knew that it's vitamin E. I don't know why, but somehow it was like a vitamin C. So that was for me a shock, and that was like what, almost 10 years ago. Probably now they are more invented, that is not this, maybe it's that. I've been seeing in TV like, oh, coffee it's good, and it's this and that, and then, oh no, it's not good. Then olive oil is very good, but then it's not good. So every time it's a research about good and bad. But when I learned from my LVN, from the licensed nurse, that was the correct answers at that time. So the world is changing. Every time is something new, which is fine. But now we're focusing 2025 and until March 2026, these NCLEX domains that I'm saying now, it's valuable from until then. In end of March will be published a new style, and then we'll see at that time what is going to be. So now we focus what we have today and what our book says. So I'm focusing on Davis Advantage Edition 3. Um, it's a little bit older because we're in 2025, and I guess the edition 3 that I'm studying this year, I think it's the latest, but some information in the book, it's kind of little bit old. So our teachers, they provide a new little advanced info because now we are 2 years later. Medicine is advancing, and all those researching is advancing, and that's why. But in the meantime, anemia, it's all anemia. So we know what means iron and what we know about B12. So this will stay there. Okay, so for today, I will explain those 15 domains to NCLEX, little bit of chapter review, and I provide 13 questions related to this chapter, but how you'll see, like, imagine that you have NCLEX and it's all about this chapter. You don't have no other chapter, and this is the chapter. And how incorporate those 15 domains in these little questions. So you'll see the way NCLEX works. If you do it this year or you do it next year. Oh my goodness, my dog is looking outside the window, and some dogs are barking outside, so I hope she doesn't bark. Okay. So these, I will take my my light, but I hope you see it. So this is a picture that I made with Gemini. Well, it's Google, we're in YouTube. Gemini is nothing new, so that's okay. I asked Gemini, little guy, to give me a picture and gave me on a square, and I said like 4 times that give me in the landscape, give me this format, and still doesn't understand, give me on square format. So I kind of like it because it's I told that I'm learning this chapter, and he gave me this nice picture. I think it's super cool. When I saw it, I said like, oh, you're so sweet. You see the little logo here? This is the Gemini logo. And I thought like, ah, so sweet. But I was unhappy with, here is like kind of, but what else I was sad because could not give me in this format. Landscape gave me in a square. Well, oh well, we're in 2025. They're not that perfect. Maybe in few years will be super perfect, but now we work with what we have. So let's go into, this is NCLEX 2025. You see, it's from Facebook. And I took a short screen. Somebody was crying that this fell, but many people are failing, well, it's okay. It's a learning process. It's nobody perfect. Everybody fail. A quiz, an exam, a bigger exam, and I think if we pass from the beginning everything, then we'll appreciate. But I think we appreciate more when we see how hard we sacrifice to do something. I think. I mean, they're doctors, lawyers, professors. Nobody passes from everybody 100% like all the time. So that's okay. I failed one class and I had to repeat the semester. Well, but that's okay. I moved forward. I learned from that, helped, and moving forward, like why I should cry now more. I should look forward for, I would say, what the life has in front of me, and learn from it. So this person, um, it says here, near, and this, the basic care and comfort. I've been seeing that most it's this the complicated base care and comfort. But when I do stimulation, so stimulation means like you get either 70 questions or you get 180 questions. This type of big stimulations will tell you which area you are lower. So the more stimulation you do, the better you improve in the quizzing taking, and give you a higher chance to pass the NCLEX. For the RN it's 75, and then for the LVN it's 85. So when I did the LVN, I passed from the first try, and my computer stopped at question 88. So I passed with 88 questions. But it took me a long time. I was there, I remember it was a question that I looked on the clock. I didn't want to go quick on the question. I was so stubborn, and I read it for 10 minutes. 10 minutes I was on that screen looking on the clock to see like how we're gonna take me this question, and it was 10 minutes. I couldn't believe it. So these 88 questions for my LVN NCLEX, it took me 2 hours and a half, and you are there I think for 5 hours. So take your time. Why you are in so rush? Save 10 minutes on a question, because there will be some question. But think about, if you mistake select all of the apply, you have to remember which category it is. It's pharmacological, it's basic care. You need to know which category. So that's why NCLEX is give you, this is from NCLEX, the latest one that they published in 2023. So it's until next year, and then next year new thing. But because this they call it a new gen because they have a little bit different, but still you need to make this pie like right here. This in the beginning is this pie here, and this all these questions, they have also this, like they combine. Be mindful that in basic care and comfort and maintenance, management of care, it's a big, you see here, it's a big slide. I call it pizza or pie. So you see this slide, like big pizza. It's really big. So this is like how an RN delegate to an LVN to CNA, and what is in your scope of practice. And basic care also can be like how you put the TED hose. Oh my goodness. Who is thinking now about the TED hose? Because you think about an LVN. But as an RN, you should know. You should have to remember because they still have, I saw in one simulation about this, and the Foley catheter, and in the new gen, like um, drop in question, you need to put the orders. Like even if a CPR, you need to put in correct order so that there aren't skills. So you have to do that. So also, what else? So you need to know the skills, right? Oh, I was thinking of something, but I forgot. We'll come back and I will tell you that. Oh, remember. So here the NCLEX, as I said, it's broken into 15 specific areas. So that's why I say this chapter, let's imagine that all the quiz, it's all about this chapter. So in specific 15 specific areas, I call it domains. It's not about just knowing your content, it's just knowing how to apply in different situations. So those domains include like the traditional, this is our traditional, the 8 categories like management of care and clinical judgment. Oh, clinical judgment, it's here, sorry. The clinical judgment, it's a huge focus on the exam, and by organizing your notes around those 15 domains, we can learn how it plays into the correct context for the exam. So making connection to the clinical judgment is like, here there are the definitions. And recognizing the cues is like what clinical manifestation are observed in this patient, right? What are they? Then analyzing the cue, like how do the clinical manifestation correlate with underlying pathophysiology? And this one, in the learning outcome of the chapter, I start on explaining on this. At the end of the chapter, it's kind of, I call it like a summary, and we go over after we finish the outline. At the end, I focus on learning objectives, so you can look, just you can go at the end and you can see the learning outcome. It's a summary, and one of them, it's exactly this: how do the clinical manifestation of whatever, what is the chapter, correlate to the underlying pathophysiology. Now we are with blood, with blood disorders. So how those are, and in outline you'll see like all 11. I will explain about all 11. Then prioritizing hypothesis, like what could happen if these patient symptoms are not effectively managed. So in outline, in which of them I will explain like complication and nursing intervention, and yeah, and then generating solution, like what treatments are included to manage this patient condition, right? So I will talk about that, and then and then taking actions. What are the priority intervention for this patient? Call the doctor every time. RNs, they can do something and then they will let the doctor know. So not for every little thing, jump on the phone or messaging the doctor, telling, oh, what I should do here, what I should do here. Oh, patient is this, patient is that. So that's why you need to take some action. Then evaluating outcome. Okay, you took take care of this patient for 8, 10, 11 hours, 1 hour. So how is the patient at the beginning? How is the patient at the end of your visit or your shift? So how was it? And so you need to know what the finding demonstrate that the treatment plan was effective. So does need any follow-up data, or what else is needed? And this I'm focusing. So on the next slides, I will make a little bit review of the chapter and explain all these domains. I give you examples from the whole chapter. For the whole chapter, I'll say like, okay, management of care, and I'll give some example for everything, and then at the end of that, I will provide some question as a practice. Okay. You see here it's our NCLEX, and we go by management of care. So direct and coordinate care that protects the client and the staff. So prioritize transfusion consent always. Double check blood products always. Delegate virals every 15 minutes during the transfusion. Yes. 2 p.m. No. While I run monitors for reactions. So keep in mind the RN has to how you say, two RNs verify, of course, consent. Keep in mind the religion, and during the RN skills, it's a class that it talks about all about blood. It's all about blood. It's like a lot. Safety and infection control protects client and for hazards. Here the neutropenic precaution for granulocytes, bleeding precautions for thrombocytopenia. And then health promotion and maintenance is growth of development, prevention, early detection. So teach iron-rich diet to prevent iron deficiency anemia. Community screening events for sickle cell trait. But health promotion and maintenance also is like when you teach about iron, it's also vitamin C and stains and how you do the injection for the iron. That's Z. Psychosocial integrity, support emotional and social well-being. So address body image concern with chronic anemia, related fatigue, and keep in mind that provide support groups for hemophilia patients. It's a lot to talk about this, but this is just like a few little kind of see where we go. Basic care and comfort, ADLs, and comfort measures. You see ADLs and comfort measures. So cluster care to reduce oxygen demand in severe, because these are hypoxia. Warm blankets for chills during transfusion reaction. Then pharmacological and parental therapies is meds and IV therapies. Administer apoetine alpha, monitor for hemoglobin, start folic acid replacement for megaloblastic anemia. Then reduction of risk potential is minimize complication from condition or procedure. So monitor for transfusion related acute lung injury. Now we go and continues. You see here we have Psychological adaptation, manage acute and chronic physical condition. Then clinical judgment, recognizing cues, ID relevant to relevant data from any sources, peticare, low platelets, analyze cues, prioritize hypothesis, rank problem by urgency and risk, general solution, define expected outcome, intervention, take action. So yeah, apply pressure to bone marrow biopsy site. This is also from previous chapter 33. 33, 34, they come back and forth. In here you see I make more how you say, more examples. Management of care, prioritize patient with acute bleeding. So who has this acute bleeding, like plastic anemia with platelets, then delegate stable sickle cell client teaching to the LVN, but retain responsibility for blood product verification. Apply SPAR, so we know what means SPAR, right? When handing off after a transfusion reaction. Safety, isolation for neutropenic clients, screen visitor for live virus vaccines, double glove when handling chemo, then health promotion and maintenance, teach iron rich foods, and vitamin C, pairing to enhance absorption, stress annual influenza, and pneumococcal vaccines, counsel for sickle cell clients on hydration, and avoidance of high altitude. And they need to have the bracelet, they have to have the extra medication in their car, they need always they need to have their supplies. What else? I mean, there are a lot, but let's move forward. The psychosocial integrity, assess body image, right, because of the chemo. Refer support group for hemophilia. Use open-end questions. This, I think I like these open questions. Always I like it. The way they make it. But this is more like I seen a lot in Kaplan stimulation, in ATI stimulation, but in my LVN was not. Oh, now I remember what I said in the beginning, that I'll come back because I was forgetting. So now I'll make a little parenthesis. So what I remember, when you take NCLEX, in case you don't know, imagine, like, for instance, since we're in here, let's say basic care and comfort, and apply warm compress, not ice, to vaso-occlusive pain. Let's say you put ice, right? And you got it wrong because it's warm, right? So let's say you got this wrong. Then, because it's basic comfort, they will give you another try, a little bit easier on this category. So if you know, and then you will know that, oh, this is kinda basic care, then you know the next question. If it's select all of the apply, that means you kind of move forward. if it's just one answer only and kind of looks like, oh yes, I know this, that means the previous one you did it wrong, and now the NCLEX give you a chance to boost on basic care and comfort. Oh my God, during NCLEX I was praying. Oh my goodness, I was praying on my own language, on my own. You know, uh, I remember I was praying because I was hearing that during my LVN program that if a person does so bad, the computer will stop before 85, because I was in LVN before 85. So I was praying to God, oh, make sure you keep me at least until 85. I don't want you to kick me out before that. You couldn't believe. And then when I finished, I had a huge headache. It took me probably 2 or 3 days, that headache. And my ibuprofen didn't work. Tylenol didn't work. I don't know. That I had this like a very big headache because I was so concentrating for that 2 hours and a half I took. He got in the break. I took the break. I went to the bathroom, put some water on my face, took few breaths, and went back. So keep in mind, you can do the same. If you stay there for 3 hours, fine. But make sure you will know each question. And on the little pad that they give you to write down, um, take your notes. Make sure that I used to make lines for select all of the apply. I don't remember, but there were a lot. But anyway, um, pharmacological, verified to licensed staff. So this licensed staff means RNs for blood product. Hydroxyurea with glove, then hold a heparin infusion if it's this, the APT, assess for petty and pre-medicate with Tylenol, and this is the Benadryl, right? 30 minutes before transfusion to reduce reaction risk. Initiate bleeding precaution. Monitor for acute chest syndrome in sickle cell crisis, chest pain. So I have here so these two pictures here, they are the outline. This is for the chapter 33 because it's hematological function assessment, and then this is with disorders for the blood. So this is their both outline, and here I will explain all this, the labs and cells, how the chapter goes, and in this one it's all about all disorders, blood disorders. Yeah, let's go further. Okay, question 1, pharmacological, right? A client is diagnosed with iron deficiency anemia, is prescribed ferrous sulfate, iron, 325 milligram PO per month, 3 times a day, or TID, right? Which statement made by the client requires follow-up teaching? I will take the tablet with a glass of orange juice. So this means requires follow-up teaching. I should, oh yes, oh my God, guys, with my LVN NCLEX, my correct answers, they were same like this one, requires follow-up. So basically, I had to look for the wrong to get my correct answer. Almost the entire exam, that was, I couldn't believe it. Which is fine to talk about this because it was like what, 8 years ago, so that's fine. That was like previous on this one, so the previous one. So so it's been a while, so I can talk about that because it's an old exam, right? But yeah, requires follow-up teaching. I should avoid taking my antacid with 2 hours of this pill. Dark stools are expected while I'm on this medicine. I will crush the tablet and mix it with yogurt if it so hard to swallow. So think about iron. What is good and what is not good? So the correct answer is I'll crush the tablet with mix it with yogurt. So why yogurt? It's incorrect here because it's milk. So you can't. With milk, not. So ferrous sulfate, it's enteric coated to reduce gastric irritation, crushing, destroy the coating. Yes, but increase gastric upset and increases absorption and decreases absorption. So it's appropriate and demonstrate understanding. Um, Psychosocial adaptation. You see, the nurse is reviewing lab results for a client with pernicious anemia. Which finding would the nurse expect? The MCV, the intrinsic factor antibody positive, serum ferritin, and platelet count. Okay, so what is pernicious anemia? And what is the most common with this one? So keep in mind. So intrinsic factor antibody positive. So the pernicious, the vitamin 12 anemia is caused by the lack of intrinsic factor. Okay, good. Antibodies to intrinsic factor are typically present. So MCV is elevated. And ferritin and platelets are usually normal. Health promotion and maintenance. Which menu choice, you see, health promotion and maintenance. Which menu choice indicates the client with folic acid deficiency anemia understand the diet teaching? Whole wheat toast with butter and coffee. Coffee, oh my goodness, this is breakfast. Yeah, when I record this dinner time. I have to walk my dog in the park and make dinner. Scrambled eggs, orange slices, and spinach smoothie. Bacon, cheeseburger, and fries. Chicken broth and plain white rice. Scrambled eggs, orange slice, and spinach smoothie. Oh, I like. If somebody makes me spinach smoothie, I will drink it. Eggs, citrus, and leafy greens are rich in folate. Other options supplies minimal folic acid. And I said about folic acid, it's liver. A client with sickle cell. So this we are in question for safety and infection control. Um, a client with sickle cell disease, okay, when you see sickle cell disease, okay, you have to remember, my patient has sickle cell. What do I know first? And then it's admitted in vaso-occlusive crisis. Imagine that you get in NCLEX, which sometimes NCLEX they give you, I heard like one person said that passed NCLEX RN with 6 case studies. 6. So imagine, oh my goodness, that is brutal because they are long. Uh, so imagine that you have a case study with sickle cell and you have to know so much about sickle cell disease and is admitted in vaso-occlusive crisis, right? Which physician orders should the nurse question? You say, administer morphine. Probably if it's this question in NCLEX, then can be like monitor and not monitor, like intervene, non-intervene. Should be given, should not be given, right? So not given means like similar like this. Should the nurse question, not given, right? If you have those dots in that table that you need to bullet point. So administer morphine, start the normal saline at 150 ml per hour, apply cold packs to joints for pain relief. Remember when we talked earlier about ice and warm thing? Give oxygen to maintain the O2 sat. The correct answer is apply cold packs to joints for relief. Remember, so should the nurse question. Cold causes vasoconstriction and can worsen shingling. Warm compresses are recommended. Other orders promote hydration, analgesia, and oxygenation. Question 5, which isolation precaution is a priority? So we are in safety and infection control. Again, safety and infection control. So which isolation precaution is a priority for client newly diagnosed with aplastic anemia? Reverse protective isolation, airborne isolation, contact isolation, droplet isolation. So it's safety and infection. It makes obvious that they talk about isolation precaution. And I don't remember if in my NCLEX told me about, asked me about isolation. I don't remember. That was like a century ago. But I'm guessing that every NCLEX, every format will ask you about isolation precaution. Even the those practice exam, it's very important with isolation precaution because I think every month you will need to do an isolation nowadays, either COVID, either C. diff, either MRSA, all those things. So you have to know for tuberculosis, you need to know which disease goes in isolation precaution. And now we have anemia, right? So it's the reverse isolation. So the bone marrow failure causes in pancytomania and protective isolation reduces risk, infection risk in profound neutropenia. You see neutropenia. So now we're in question 6, pharmacological and parental therapies. So we are back to pharmacological. A male client with glucose 6, G6PD deficiency is prescribed trimethoprim sulfamethoxazole. So this is the meds that NCLEX will ask you for generic. I know, I know those names, but it's hard for me to pronounce because of my accent. Um, which action should the nurse take? Administer the medication as ordered, hold the drug and notify the provider, give a high protein meal, verify the client's blood type. Hold the drug and notify the doctor. Because the sulfonamides can trigger the hemolysis in G6PD deficiency. The nurse must question the order. So if you go in outline, I talk about this medication. And one more thing, that it's so into this disease. Management of care. So we are in question 7. I have 13. So 13 question and we are in question 7, management of care. Which intervention should the nurse include in the plan, care plan for the client with polycythemia vera? So this polycythemia, what means? Poly means a lot, red blood cells. Encourage 3-liter fluids daily unless contraindicated. Apply sequential compression devices while in bed. Limit ambulation to conserve energy, and maintain the head of bed flat unless hypotensive. Encourage 3-liter fluids a day unless contraindicated, because hydration decreases blood viscosity and reduces the risk of thrombosis. So strict bed rest, no, and flat the head of bed increase the blood clot, and hot shower or sauna. Pharmacological, again, pharmacological and parental therapies. Domain. A child with hemophilia A. So what is hemophilia? Presents with hematolosis of the knee. Which nursing action is most appropriate? Passive range of motion. Passive means that you are doing for the client. Apply warm compress. Administer desmopression. IV as prescribed. Elevate leg below the heart level. So what do you think? So administer the desmopressin IV as prescribed. Why? Because stimulates release of factor VIII for mild hemophilia A and controls the bleeding. Active range of motion or warm can worsen the bleeding. Leg should be elevated above the heart level. Health promotion and maintenance. Question or domain. When teaching a teenager with hemophilia B, earlier was hemophilia A, now we're in hemophilia B, about physical activity with sport is safest. Soccer, basketball, swimming, wrestling. swimming. Low impact, no contact sports such as swimming minimize joint trauma and bleeding risk. Psychosocial and did I repeat 2 times? Psychosocial and psychosocial adaptation. Domain for NCLEX. We have question: a client on heparin therapy develops a platelet count drop from 250 to 95 in 48 hours. What is the nurse first action? Stop the heparin infusion immediately, administer protamine sulfate, prepare for platelet transfusion, notify the healthcare provider after next dose. So what you do if drops the platelet count? You stop the heparin infusion immediately. So abrupt platelet fall suggests the heparin induced. Heparin must be stopped at once. Protamine reverse bleeding, not for heparin. Platelet transfusion is controversial unless life-threatening bleed. Safety and infection control domain for the NCLEX. Question: during induction chemotherapy for acute myeloid leukemia, which finding requires immediate intervention? We have oral temperature 100.4 Fahrenheit, absolute neutrophil count 1000 cells, platelet count 90 times 10 cubes, serum potassium 3.6. So what is the value of 3.6? It's oral temperature 100. Why? Because above 100 in neutropenic client is oncologic emergency, possible sepsis, requires blood culture and blood spectrum antibiotic stat immediately. Safety and infection control domain again. They are very safety and infection control and meds is very important with anemias disorders or blood disorders, because you need to make sure that the patient gets the best care, and the best care is meds and safety. And for this chapter, this is the priority. Which meal tray will the nurse remove from the room of a client with severe neutropenia? Hamburger cooked medium well, sealed single serve yogurt, peeled and eat banana, boiled white rice. Oh, I have rice for tonight. A hamburger cooked medium well. Why? Because all meats must be well done for neutropenic diet. Medium well still poses bacterial risk. So now we go in the last question. Psychosocial adaptation. A client with multiple myeloma, what is myeloma? Reports back pain, rated 8 out of 10. So even if it's not myeloma, if it's for something else, so what we do? Which order should the nurse implement first? You see, what is the order? First, encourage ambulation 3 times daily, apply a heat pack to the lumbar area, administer IV morphine, administer assist to sit up straight in the chair. administer IV morphine 2 milligrams now. Because the bone distraction causes severe pain, promote opioid analgesia, it's a priority. Heat may worsen hypercalcemia. Weight bearing without analgesia increases fracture risk. So I hope these little questions, it made make a little bit sense, and you kind of know now how NCLEX will work if you have anemia questions. Look on outline for a little refresher if you like, or just you just practice more of those questions. I hope you enjoy, and I will see you in the next chapter about skin.
We finally made it!
Thank you again for your time and trust. I'm Leukemia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.